All right, there's a law in physics, Dalton's law, that says simply that in a mixture of gases, the total pressure is the sum of each individual partial pressure. Now what that means is this. Right now, what we're using in those tanks, we're taking regular atmospheric air. We're taking it and we're pushing it in that tank. Now we treat it a little bit before it gets in the tank. We filter out certain elements that we don't want in there. So the area you're getting in that tank is probably the best area you're ever going to get. So, but this air is actually composed of a number of gases. There's oxygen, nitrogen, helium, hydrogen, CO2, radon, H2O, and there's a bunch of other gases. The percentage, if we look at the percentage of these different gases, it's roughly 21% oxygen, 78% nitrogen, and the rest is 1%. The rest of these rare gases, 1%. For our use, for our purposes right now, let's just simplify everything and say that oxygen is 20%, nitrogen is 80%. Here at sea level, right now, the atmospheric pressure is roughly 14.7 psi, pounds per square inch. Again, let's round that off, just make it 15 psi. If 20% of that pressure is oxygen, that means that we take 20% of 15, it is 3 psi, is oxygen pressure. That's what we call the partial pressure of oxygen in this mixture of gases. It's 3 psi. So that means nitrogen, if the total is 15, nitrogen would be the remainder, or 12 psi. So that's the arrangement. Right now at sea level of what we're breathing, we're taking in 3 psi partial pressure of oxygen and 12 psi partial pressure of nitrogen. That's at sea level. Now if we go down to 33 feet diving, breathing compressed air, down there the pressure is going to be 2 times greater than what it is at sea level. So our regulators are going to be giving us air at whatever pressure we're at, ambient pressure. So down there, the total, if the total pressure up here is roughly 15, down there is going to be 30 psi. Now it's the same mixture of gases. We're breathing down there at 33 feet as we're breathing up here. It's 20% oxygen, 80% nitrogen. But down here, if I take 20% of 30, we get 6 psi for oxygen. So that means the remainder is 24 for nitrogen. So what happens is, now the air that we're breathing at 33 feet is going into our lungs, and then it's transferred into our bloodstream. That's how we get oxygen. But along with oxygen, we're also getting all these other rare gases going into our bloodstream and being carried to our body cells. So if I check a cell on my little finger at 33 feet, I'm going to have 24 psi of nitrogen and 6 of oxygen. 66 feet, going to be 3 times the pressure. So down there is going to be 45 psi. Again, it's the same mix, so if we take 20% of 45, we're going to get 9 psi for oxygen, and that means 36 for nitrogen. So as we go deeper, we're getting increased amounts of these gases into our body cells. we are acclimated to sea level amounts of these gases. Anything more or less, we're going to have some reaction to. And that's what we have to take a look at right now. Let's first of all look at oxygen. What we call O2 poisoning. The oxygen that we like and love and need here at sea level. As we go deeper, we're taking increased amounts into our bodies. When that partial pressure of oxygen reaches, on an average, 30 psi, we come down with oxygen poisoning. Symptoms are confusion, vision problems, muscle twitching, convulsions, and then finally unconsciousness. We do not reach this level of partial pressure of oxygen using compressed air. We're putting in these tanks, compressed air. We do not reach this level until we get down to around, on an average, around 300 feet. So normally we don't have to worry about oxygen poisoning because we are not going that deep. In your open water course, you're limited to 60 feet. However, some people are sensitive to it shallower than 300 feet. It's actually a bell curve. Some people are sensitive to it, the amounts they get as shallow as 60 feet. Some people not until 400 feet. So that's one of the reasons we have 60 feet as your depth limit for the open water certification. Because there's no test we can do on anybody to figure out when you're going to get oxygen poisoning. The only way we can determine what your sensitivity is if you go down and get it. If you go down and start showing any of these symptoms. That's why the first time you go past 60 feet, it should be done under controlled circumstances, where you've got somebody along with you who has been down there before and they know they can handle any depths deeper than 60 feet. And if they notice any unusual symptoms in you, they can bring you back up. Because to cure oxygen poisoning, all we have to do is come back up. Goes right away. No lasting effects from it, except for membranes. If you breathe oxygen too long, increased oxygen over a long period of time, it can affect your membranes. But that's not something we have to be concerned about right now. So, to avoid oxygen poisoning, we just can't go that deep until we know how we can handle it. If we use, though, pure oxygen in these tanks, that's 100% O2. If we use pure oxygen, we hit this partial pressure in only 33 feet of water. That's why we do not use pure oxygen in those tanks. And that's why it grates on a diver's nerves when they hear somebody call those oxygen tanks. They're air tanks. Because we had pure oxygen in there, at 33 feet you can start showing these symptoms that we don't want. Now, it becomes an item if we get into nitrox diving. Nitrox diving is something you would do after this open water course to learn how to do nitrox. Nitrox is, we put some pure oxygen in that tank and then we fill it up with regular air. So that instead of a percentage of 20% oxygen, in nitrox diving, you can have 32%, 36%, 40% oxygen. Nitrox was originally used to speed up decompression to avoid decompression sickness. It has started to be used, though, into recreational diving and technical diving to help prevent decompression sickness, to get more time underwater, but you're going to be using increased amounts of oxygen. So in nitrox diving, you have to be even more concerned about oxygen poisoning, because if you're an individual that would normally get oxygen poisoning on compressed air, let's say around 250 feet, on nitrox you may get it as shallow as 130 feet, let's say. Okay. So before you try nitrox diving, you should take a nitrox course and learn all the different effects of this increased oxygen. Nitrogen. Increased amounts of nitrogen that we're breathing causes a problem, not really a bad problem, but it's called nitrogen narcosis. Deeper you go, the more the effects of nitrogen narcosis kicks in. There's three effects. One is your thoughts processes are slowed down. It's harder to think. It's harder to solve problems. I gave some people some multiplication problem here on the sea level to do, and it took them an average of 10 seconds to do that problem. 60 feet deep, it took them almost 20 seconds to do the same problem. And at 9 and 9 feet, some of the people could not do the problem at all. But yet, if you ask, "Are you okay?" you say, "Yeah, I'm okay." You don't know how the narcosis is affecting you sometimes unless you do some type of mental test. And that's one thing that we do in the advanced course, where we take you down deeper than 60 feet. Besides checking you out for oxygen toxicity, we also check out your tolerance to narcosis. Because you see how you can maybe get into trouble if for some reason you cannot think through a problem. Fortunately, in diving, there's not that many problems you have to worry about. But your thought processes are slowed down. Also, it relaxes you and it makes you happy, euphoric. The deeper you go, the happier you are. I remember a case of a diver up in a blue grotto down around 60 feet. This was a cavern dive. And I looked, and that diver had her head up against the rock wall in a swimming position and just kicking, not going anywhere. I went down and turned her around, and I could see the smile on her face. She had no idea what she was doing, but she was having fun doing it. So, this again is one reason a lot of people like to deep dive, go past 60 feet. It's because it's very relaxing. You get very happy. It also affects us, our senses. Touch, sight, hearing are all affected by narcosis. You hallucinate, and it usually doesn't get effective until you get down around 100 feet. To cure it, all you have to do is come back up, goes right away. To prevent it, you stay shallow, and if you're using nitrox, you've got less nitrogen to contend with, so then there's less effect of nitrogen narcosis. Another effect of nitrogen is it's absorbed by all your body tissues. Blood, muscle, bone, fatty tissue. If you're at 33 feet, you're taking in twice as much nitrogen. So all these tissues are going to end up getting increased amounts of nitrogen in. Normally, anything shallower than 33 feet, you're down there a certain amount of time, and you come up, you're going to have more nitrogen in your body than when you started. So while you're on the surface, you're going to be exhaling more nitrogen than non-divers do. Fortunately, it doesn't smell, so nobody can smell it if you're exhaling it. But after a dive, you're going to be exhaling more nitrogen than a normal non-diver. Okay. If you go deeper than 33 feet on compressed air, when you come back up, this nitrogen cannot stay in solution at sea level. When you come back up, that nitrogen can form, or does form, bubbles in all of your body cells. Blood, tissue, muscle tissue, bone tissue, fat tissue. So anytime you're going diving past 33 feet, generally, when you come back, you're going to have nitrogen bubbles in all your body tissues. In most cases, you feel nothing. You may be a little bit tired after a dive, a little bit fatigued, because those bubbles, when they pile up next to the alveoli with the venous blood coming back, it blocks off the off-gassing of the carbon dioxide, which can make you tired. Now, once these bubbles occur, it can take up to 3 days for them to completely go away. 3 days. That's why it's recommended that you do not dive for more than 3 days in a row, because these bubbles are accumulative over 3 days. Now, if you get enough bubbles, they're big enough, they can cause symptoms. Bubbles in your fatty tissue, large enough and enough of them, will cause a rash or an itch. Nitrogen bubbles in your muscle tissue can cause muscle pain. Nitrogen bubbles in your bloodstream, we already talked about, it can make you tired after a dive. Nitrogen bubbles in the bone tissue can accumulate around the joints, and you can experience joint pain. But more importantly, if it's constantly being done, every dive you're getting bubbles formed around the joints, eventually you get breakage in there and you get calcification. So after you've been diving a long time with these bubbles occurring in your bones, especially, divers would get bent out of shape. They couldn't move. That's where the name the bends came from. We also have another name for it called caisson disease. Because it was originally noticed in the workers that were building the tunnels underneath the rivers up in New York. Because what they would do to keep the water out is they would use air pressure in there to keep the water out of this caisson that they had. In doing that, these workers, it was same as diving. They were under pressure. They were breathing increased nitrogen. So when they came back up after 8-12 hours of working, they showed these symptoms of decompression sickness.
Hi, this is Sandra at 954-663-5975. Sandra, 954-663-5975.
So that's where the name caisson disease came from, because these workers were showing symptoms of decompression sickness. But they didn't know it was decompression sickness at that time. So they just said, it's a disease they're picking up down there, so we'll name it caisson's disease. The worst possible situation, though, is if those bubbles get into the spinal column and they block off the nerves. While these bubbles are there, they're tearing at the tissue. So you could end up with paralysis, lack of coordination, all kinds of nervous symptoms, nerve deterioration, especially paralysis. So, the only way we can cure or get rid of these bubbles before they cause damage is to recompress. Using Boyle's law, that bubble that is this size on the surface, 33 feet down is going to be 1/2 the size. 66 feet is going to be 1/3 the size. If you keep going deeper, the bubble eventually will go back into solution. But it's not very effective to take a scuba tank, go back underwater, and go back down to 33 feet. It may take 2-3 days to get rid of the effects of those bubbles. So we have to use a recompression chamber. Some hospitals have these. It doesn't do any good to go to a hospital that doesn't have one. They can't do a thing for you, except give you pure oxygen. That helps to get rid of some of the effects of the nitrogen bubbles. So, rather than go down, make a dive, come back up, and have all these bubbles causing problems, and having to use a recompression chamber, we prefer to prevent decompression sickness. We have 3 preventions. One is, as long as you stay above 33 feet, you don't have to worry about it. Generally, in most cases. 33 feet or shallow, you don't have to worry. However, if you do go past 33 feet, we have a second prevention, and that's called limits. What we call no decompression limits. No decompression limits. This is the amount of time you can go down and spend at any depth, and when you come back up, you don't have to worry about decompressing or getting bad effects of those bubbles. We have a table that we look at to determine your no decompression limit. Because decompression sickness is a function of depth and time. So at every depth we have a no decompression limit, where if you do not spend more than a certain amount of time, when you come back up, you should not have any problems with decompression sickness. However, if you do go over that limit, we have a third prevention called decompression. Decompression, which is different than recompression. Decompression means while we're down there, on the way back up, we stop at certain points. So say 20 feet, spend some time there. We go up to 10 feet and spend some time there. These are called decompression stops. And then we can get out of the water. We try to avoid decompression diving, because when it says you've got to spend, let's say, 5 minutes at 10 feet, you got to make sure you're at 10 feet, and you got to make sure you spend 5 minutes there. And there's no going up, running out of air, going up, getting another tank, coming down, back down, and finishing up where you left off. As soon as you go past that decompression stop, you're going to get the bends or decompression sickness. So there's too much planning involved in decompression. There's too much worry. People take up recreational diving for recreation. They don't have to have a worry about things, worrying whether they've got 10 feet exactly, making sure they got enough air left. So we like to practice these 2 preventions: stay above 33 feet or dive within your no decompression limits. You will hear this term sometimes: safety stop. What this is you come up on a dive, if you're past 60 feet especially, you come up, or actually deeper than 30 feet, you come up to 15 feet and spend 3 to 5 minutes there. That's a safety stop. Even if you're diving within your decompression limit. For example, at 60 feet, let's say your limit is 50 minutes. You spent 40, well within your limit, but still, to be on the safe side, you come up to 15 feet and spend 3 to 5 minutes there. That's because these dive tables are average, they're for an average person. So there's always extremes on each side. So you want to make sure you're safe. Even the computers we use build safeties in. Okay? Now, with the safety stop, if you come up and you miss that, chances of something happening are pretty slim. But if you miss a decompression stop, your chances are much better that you can get decompression sickness.